This is a one-of-a-kind story. A surgeon catches cancer from a patient which is first of its kind case. Tyrone Bowman live. Let's talk about this story as reported by Daily Mail. A doctor operating on a cancer patient accidentally transplanted the disease into himself in what is believed to be a one-of-a-kind event. A 32-year-old man from Germany had been diagnosed with a rare type of cancer and was having a tumor removed from his abdomen. While in surgery, the doctor performing the procedure accidentally cut his hand, but the wound was disinfected and bandaged immediately. However, 5 months later, the 53-year-old surgeon noticed a small lump developing where he had been injured himself months earlier and sought care. The lump turned out to be a malignant tumor, and tests showed it was genetically identical to the cancer suffered by his former patient. This led the medical team who treated him to conclude that he caught the cancer when tumor cells entered the cut on his hand. Authors of the case report called this an unusual situation because in a traditional transplant, the body mounts an immune response and rejects any foreign tissue, and they would have expected the same in the doctor's case. However, given the tumor's development and growth, it suggests the surgeon's body had an ineffective anti-tumor immune response. While the case was originally reported in 1996, it has resurfaced with renewed interest. Published in the New England Journal of Medicine, doctors detailed the accidental transplantation of the patient's malignant fibrous histiocytoma, a rare type of cancer that forms in soft tissue with just 1,400 diagnoses per year. The doctor injured the palm of his left hand when trying to place a drain in his patient while performing surgery to remove the cancer from the patient's abdomen. The wound was immediately disinfected and bandaged. While the cancer patient's initial surgery was successful, he died following complications after the procedure. So 5 months later, a 1.2-inch tumor-like swelling appeared at the base of the doctor's left middle finger, and he visited a hand specialist. An extensive exam was conducted, including numerous laboratory and blood tests, which revealed no abnormal findings. The tumor was removed anyway, and examining the mass under a microscope revealed it was also a malignant fibrous histiocytoma. Physician who had been treating both the cancer patient and the surgeon raised the question whether the tumors were related. Samples of both tumors were further analyzed and were determined to be identical. They both had the same types of cells and arrangement of those cells, meaning the surgeon may have unknowingly transferred cancer cells from the patient to the cut in his hand, allowing the disease to take root and growth in his body. The authors wrote, normally transplantation of allogenic tissues from one person to another induces an immune response that leads to the rejection of the transplanted issue. The authors speculate the tumor escaped immunologic destruction through several mechanisms, including changes to molecules in its cells and a failure in the surgeon's body to recognize and attack tumor cells effectively. 2 years after the surgery, the surgeon had his own tumor removed. There were no signs the cancer had spread or returned. Doctors noted the case was interesting because transplanted tissues differs from the host tissue and is usually targeted by the host immune system in an attempt to destroy it. This is why organ recipients must take immunosuppressive drugs to make sure their body does not reject the transplanted organ. But while the surgeon developed inflammation around his original cut, his immune response did not stop the tumor from growing. Cases like the surgeon's are extremely rare, and there are no statistics or transplanted cancer. In a 2013 review of these cases published in the Cold Spring Harbor Perspectives in Medicine states there is no estimation of risk for transmitting cancer from donor to recipient, and there is limited data on the subject. Report authors wrote, the incidence of any cancer transmission is so low that sporadic case reports are the main source of information. An earlier review from 1993 that looked at data from the 1970s also found there were only sporadic reports of cancer being transmitted through organ donation. The 2013 review added, the low frequency and very variable stage of cancer means that definitive risk calculations are impossible. So, however, the authors continued, the data is highly likely to underestimate the true incidence. So, using the limited data available, authors of the 2013 report found cancers known to have been transmitted from donor to recipient on at least one occasion include breast cancer, colon cancer, liver cancer, lung cancer, melanoma, ovarian cancer, prostate cancer, and renal cancer. What a story. Never surrender, never quit.